Hi, good afternoon, everyone. It's a pleasure joining this webinar today, and I'm happy to welcome you to this month's edition of the Yaba Voice webinar. I hope you're doing well. How are you? Now, if you could put it in the chat box, please just put an emoji to describe exactly how you're doing today. In Lagos, Nigeria, Yaba precisely, the atmosphere is cool, and so it's a cool day. I hope you're also feeling cool where you are. So we are happy to welcome you to this month's episode of the Yaba Voice. We have something very interesting for you today. It's quite educative, it's informative, and it would cause a turnaround because you really need to have this conversation today. But before we go on, I would welcome the medical director. Oh, thank you. Thank you, Yesterday Alabi. Oh, cool day. Thank you so very much for that response. Thank you so much for that response. I would welcome the medical director to welcome us formally to this webinar. Over to you, Dr. Olubenga Adekile Oweye. Over to you, sir.
Yes, good afternoon, everyone. I welcome you to today's edition of our regular webinar by Yaba Voice. And today's, sorry for all this disturbing, sorry. So once again, good afternoon, everyone. I welcome you to today's webinar by Yaba Voice on topical mental health issues. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a platform of Federal Neuropsychiatric Hospital Yaba Lagos, through which the hospital create awareness and educate the populace on mental health issues. Today's topic is From Addiction to Recovery, Understanding the Menace and Exploring the Solution. From Addiction to Recovery, Understanding the Menace and Exploring the Solution. As we all know, more and more people are now living in drug-like circumstances and are actively engaged in drug-using behavior. Recent data shows that incidence and prevalence rate of substance use and substance use disorders among people are increasing across a range of socio-economic strata. The World Health Organization reports that up to 90% of children living on the streets worldwide use some kind of substance. And this creates a large burden for the family, community, and a great danger for the future of the family and the country in general. Hence, they need to create awareness and adopt a preventive approach to this problem. In today's webinar, the following questions are answered. What do we understand by drug addictions? What are the risk factors for it? How do we recognize the problem early? What are the available solutions to this problem of addiction? And how do we prevent them from even occurring in the first place? With me on the platform today, I have two elder scholars to address this issue. Our first presenter today is Dr. Olajumoke Mosumola Koyejo. Dr. Koyejo is a consultant psychiatrist with further specialization in addiction medicine. She obtained a degree of Bachelor of Medicine and Bachelor of Surgery from Obafemi Awolowo University, Ile-Ife, and fellowship in the field of psychiatry from the National Postgraduate Medical College of Nigeria. She also has a master's in public health from the University of Lagos and the fellowship of the Fulbright Scholarship Training in Substance Abuse Prevention treatment, education, and policy from Virginia Commonwealth University in United States of America. She has further certification in tobacco prevention, treatment, protection, and evaluation from the Ontario Tobacco Research Unit. She is an international certified addiction professional from the Global Center for Credentialing and Certification, also in USA. She's a clinician and addiction education trainer. She works as a consultant addiction psychiatrist at the Federal Neuropsychiatric Hospital, Yaba, Lagos. She's one of the coordinators of the Colombo Plan Drug Advisory Program courses in Nigeria. And Dr. Koye was trained addiction professional at the West African countries. She has organized and facilitated over 60 trainings for addiction professionals across Nigeria and West African countries. She is a researcher in the field of addiction and is presently the head of addiction and telehealth research group of the hospital. Dr. Olajumoke Koyejo is a passionate advocate of good mental health for all, and her participation as volunteer in various mental health programs is palpable. Our professional goal is to continue creating awareness in the field of addiction prevention, treatment, education, research, and policy. Our second presenter today is Dr. Ayodeji Olubunmi Ajayi. Dr. Ajayi is an assistant director, clinical psychologist with the Clinical Psychology Department of the Federal Neuropsychiatric Hospital, Yaba, Lagos. He has a doctorate degree from the Lagos State University and master's degree from University of Lagos in clinical psychology, while his first degree in physiology from the University of Ibadan. He has worked with people having different forms of psychological distress in his clinical and private practice for over 15 years. He has been involved in various national services. Notable is his involvement with the psychosocial support team for family members of the Dana air crash, patients of the Ebola epidemic, and psychosocial support group for COVID-19 pandemic. He is an internationally certified addiction professional with ICAP 1 and 2 and a UNODC global trainer. He also possesses high-field awarding body for compliance level 3 international award in delivering training with London Professional Training Center. Dr. Ajayi has been involved in training and presentation within and outside the hospital with various professional bodies and groups. Currently, Dr. Ajayi is the secretary of the Nigerian Association of Clinical Psychologists in the Lagos State chapter. I want to enjoin all of us to kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Over to you, Dr. Kemi Akitoyesi.
Thank you so very much, the medical director, for that arousing welcome. And usually, you know, when the medical director welcomes us, it would kickstart the conversation for us. So he has already given you an insight into the conversation for today. But please, significantly, if you know somebody that needs to be here, can you just quickly reach out to them and tell them that, yes, we had commenced this webinar as well. They can also view this webinar on the Facebook page of the Yaba Voice FMPHY. One word, you would be able to access this webinar as we go on. But please kindly just reach out to someone, because this is a very, very, very important conversation that we must have. We are looking at from addiction to recovery, understanding the menace and then exploring the solution. And if you would agree with me, addiction is biting into the core fabrics of the society. And if we are not careful, it's going to engulf everyone, and then we may not be able to find a solution. Dr. Koyejo and Dr. Ajayi, They are well prepared and ready to start this conversation and to tell us all that we need to know when we are talking about addiction. Like you heard them read, they are key experts in this conversation. So prepare your questions and get ready to have them answered. Dr. Koyejo would be addressing for us, first of all, when we're talking about addiction, drug addiction, what are we talking about? And how does addiction occur in itself? Over to you, Dr. Koyejo.
Thank you very much, the medical director and the whole Yaba Voice team. And our viewers, good morning, good afternoon, good evening, depending wherever you are. Well, I would like to start by defining addiction. We're all going back to school. That's what Yaba Voice does. And I'll define addiction by explaining that it's a chronic or long-lasting, relapsing, that is recurring brain disease that affects either the mood, thoughts, perception of behavior, and sometimes consciousness. And at the point it becomes the central point activity in the person's life. Addiction should not be limited to substance alone. Addiction can be behavioral or substance addiction. Behavioral addiction includes gambling, sex addiction, pornography, and the rest. While substance includes cannabis, cocaine, tobacco, and the rest. And that's just a brief way of defining what addiction is. Thank you very much, Dr. Akintoyeshi.
All right, thank you so much, Dr. Koyejo. Now, Dr. Jayi would continue this conversation by also helping us to understand the factors that contribute to addiction. What are those factors that makes people to become addicted? Over to you, Dr. Jayi.
Thank you very much. Once again, I want to welcome all our listeners from different areas. Good morning, good afternoon, good evening. We are most excited to have you on this platform. And we're talking about a major issue, and it's fast becoming a menace. And if you don't watch it, obviously, a lot of people will be engulfed. And that's why this generation, we're having an extinction of a generation. And if we don't do anything about it, more things will happen. So we're talking about what are the factors that contribute to addiction. We need to understand what the problem is so that we can understand the solution. I'm going to be looking at it from the point of biological, psychological, and social factors that contribute to addiction. On the part of the biological, we have a genetic factor. We find out that a lot of people have family history. And because of that, they are genetically predisposed, especially for people who use cigarette and alcohol. And a lot of other biological link has been found between the substances and other forms of substances. We have biochemical history. We talk about the neurotransmitter. Dopamine is actually highly implicated because it it's one of the feel-good chemicals. The moment you have a outpouring of dopamine, you find out that a lot of people feel good about it. And this affects the reward center, the pleasure center, and the midbrain. And what happens? You find out that when people, the natural sleep, good massage, good food, and good drink, may not have the kind of effect that these psychoactive substances have, because it causes a lot of an overwhelming effects of these dopaminergic neurons. You find out that from this, a lot of people feel more pleasure from substance than any other thing. The kind of pleasure we feel from cannabis is like times 2. I mean, times 10 of what we feel from other substances. Then that you find out that more males are involved. Then let's go to the psychological factors. We're talking about personality factors. Some personality disorders are more predisposed. Talk about borderline personality, antisocial personality. They are more predisposed, and a lot of people have this kind of issues. Then the psychodynamic theory tells us that people who are fixated at the it is about pleasure. They just want to enjoy pleasure. They are not bothered about the effect of their habits. So because of that, a lot of people who are fixated at that level, they actually do more for addiction. Then more importantly, behavioral theory tells us that behavior is learned. People learn from models. Oh, the moment they see their parents or significant others doing this thing, they get involved. So the behavioral theory is also implicated. Then cognitive theory tells us that, when people tell you that, A lot of people will tell you, oh, it makes me sleep well, oh, it makes me eat well, it improves my appetite, oh, it helps me for this and that. You find out that a lot of people are fixated in their interpretative style. Even they explain these things to themselves. Just like I ask most of my patients, have you not been sleeping well before you started using cannabis or most of these substances? You find out that it's the lie they tell themselves. Don't forget, the substance also comes with what? Impaired judgment. And because it impairs their judgment, they believe it that, oh, this thing makes me feel well, oh, it makes me sleep well, it makes me eat well, it makes me do this thing very well. So you find out that a lot of people are hooked on it because of their interpretative style, the explanatory style. But more importantly, a lot of people have they've suffered trauma or abuse. Imagine people who have gone through chronic stress, trauma, or abuse. They've used psychoactive substances to medicate the effects of all these things. And because of that, they get hooked on it. Then some people have co-occurring mental health issues. PTSD, people who have schizophrenia, you find out that they hear voices and they use the substance to ameliorate the voices. Then some people have depressive symptoms. They use alcohol, and alcohol even worsens the depressive symptoms. So then other things are the age of onset. You find out that a lot of people start using it early when their prefrontal cortex is not even well developed, and because of that, they are hooked on it. They can't actually exercise the strength, and that's the problem. Then the substance characteristics. There are some substances that are actually very, very addictive. People using the legally accepted substance like cigarettes and alcohol, they are more prone to it. Then cannabis is also very addictive. The other substances like cocaine are also very addictive. Then let's look at the social effect, peer pressure. You find out that a lot of times family factors that the family members are using, cultural factors. Some people like they tell you about sapele water. In sapele, the alcohol is water, and because of that, a lot of people get hooked on it. Then availability. You find out that a lot of people don't have any business with substance except for their availability because it's right there. They can get it anywhere, and because of that, they just want to try it. And when they try it, they get hooked on it. So early exposure too could be a problem. Decline in moral values. You find out that this age is everywhere. You find out that the social media, everybody talks about substance, and unfortunately, some of our musical videos, you find out that a lot of them talk about substances, and they use substance freely. Unfortunately, these things are not censored. They use substance freely. They use alcohol. They use substance. They glamorize use of substance, and that's actually becoming a problem. Then a lot of people also have occupational factors. People who get involved in some occupations, they can actually be more addicted to the substance, like people who are into military or some other kind of activities. So we continue from there. Thank you for listening.
Thank you so very much, Dr. Ajayi has taken us to town to understand some of the factors that contribute to addiction. And I think one of the major ones that we are seeing in this generation is the fact that it's quite available. For a lot of people, we don't even get to see, we don't know what it is. What does weed look like? We do not know, but now it's just virtually everywhere, every corner, you get people using it. And that's making a lot of people now to even indulge more. Now, but then again, as much as it's prevalent or it's common, some people don't even know what the signs and symptoms are. What are the signs and symptoms of addiction? Because most times parents don't get to even know or realize that their children are using or people around them are using. And so because they do not know, it allows people to use for longer periods. So I was seeing a client yesterday who said, oh, I've been using for 7 years and my parent did not know. Most times when I come for holiday, I try to maintain. Then when I go back, I continue. So what are the signs and symptoms of addiction? Dr. Koyejo will be addressing that for us. Over to you, Dr. Koyejo.
Thank you very much, Dr. Akintoyeshi. We're talking about addiction, and it's important for our viewers and for everybody around to know about it. Well, going to the signs and symptoms of addiction, there are some symptoms that are very general, and there are some that are specific to these substances. And I'd like to start with the general symptoms that people should watch out for. Like she mentioned, some people are so secretive that you never catch them with it. You never catch them with the paraphernalia. So what are those general things that when you see them, although they might not be equal to, but there are things that when you see them, you should think of what is happening to this person. The first thing I like to talk about is mood changes. A very gentle, quiet person now been highly irritable, temper flare-ups, being defensive. It might, and consistently becoming like this. Definitely something might be cooking. Academic problems. An high flyer in school now doesn't even care about school anymore. The gradual decline in grades, something might be cooking. When people start changing their friends and reluctant to have parents get to know the new set of people that they are moving with, that's new drift. Might be something, might be the beginning of substance use. You can see a child avoiding high contact, ignoring or breaking curfews. This child would always, before now, would always adhere to strict curfews. It must come back home before this time. This might be a sign that something is happening. A child acting irresponsibly, frequently asking for money. Can I have that quick 2,000 naira there, that quick 3,000 naira? What do you use it for? When money start getting missing in the house, when the child start becoming secretive and locking bedroom doors and making secret calls, withdrawing to self, and this child has many excuses now with them outright, sometimes outrightly lying, withdrawing from people, resisting discipline, missing schools, losing interest in hobbies, and things that are previously pleasurable, abandoning long-time friends. These might be general signs that parents and caregivers should watch out for. There might be signs of addiction. Like I said earlier, they are not equal to. But when all these things start coming, try to check for the cause. Why is this happening? But let me go to specific things that you might have to watch out for that might be signs of addiction. Bloodshot eyes and cannabis users, irrational behavior, now having paraphernalia of needles and needle tracks, wearing long sleeve clothes. These might be specific things that are related to addiction. And like I said, of course, catching the child with it's a very big one, and that mustn't be explained out easily like that. So you must keep asking questions. Well, let me stop here and let me go back to Dr. Pintorishi. Thank you very much.
Thank you so very much, Dr. Koyejo, for that. She had given us the general, and then she had also narrowed it down to specific. For some of the people making attempt to come into the webinar session says they are having challenges. We don't know which platform you're trying to log into, or if it's the Yaba Voice page, webinar page that you're coming in, it brings you here directly. And since we had started the webinar, there is no waiting out there, but we have tried to replace post the link on the chat. So you just copy it and send it to the people who claim that they are waiting they're in the waiting room, so they can rejoin this. Okay, we would appreciate if Mr. Abraham AA helped us to just do that, because once they click on this link, it must bring them into this page directly. So we would appreciate if you're able to do that for us. Thank you so very much. Okay, so Dr. Florido had actually helped us to understand the signs and symptoms, the things that we see. I didn't know for me, but most times I just understand that there are significant behavioral changes that occur when people start indulging in substances. And these are some of the things that we must begin to watch out for. But one thing that I've also discovered is that sometimes we want to shy away from the reality of what is going on. Sometimes parents tend to tell themselves, oh, it's not possible. I talked about it. I've heard that during sessions when parents will say, it crossed my mind, but I do not want to believe it, because I do not want to believe that my own child would be going or will be doing something like this. But that also now brings us to the menace that is associated with addiction. Because if we do not start confronting the truth, then it will take us to very great difficulties that may be very difficult to handle. So, Dr. Jai, please to share with us, what are the menaces or whatever the consequences and the cases associated with addiction? Over to you, Dr. Ajayi.
Okay, thank you very much, Dr. Akintoye. Yes, the issue of addiction is actually a growing problem. Whether we like it, sometimes ago, the President of America declared a state of emergency on opioid. But beyond opioids, I think we need to actually declare a state of emergency on most of the substances because it's fast becoming a menace, becoming a problem, because most of our young generation are actually getting extinct because of the substance. They're not functioning, they're not doing well. So some of the challenges that we have, I actually group them into physical or biological challenges. Then we talk about the psychological and the social. Under the biological or physical problem, you find out that a lot of people can develop respiratory tract problem like bronchitis, chronic obstructive pulmonary diseases, then cancer, lung cancer, and whatever. Then a lot of people have endocrine issues like infertility problem, and they have some challenges with some hormones. The hormones becomes distorted. Then blood anemia and reduced immunity, thrombocytopenia, and some other things. Then you have cardiovascular problems. People have hypertension, thrombosis, very. And you find out that just recently, somebody sent a video, and I was telling us on YouTube that hypertension is actually highly linked to substance use, especially alcohol and even cannabis use. And these are things that we've known over time. Then digestive system, you find out that you have gastritis, peptic ulcer, and a lot of them also have a lot of issues with their liver. Yeah, muscular problem, they develop myopathies. Then reproductive system, infertility, reduced libido. Some of them have fetal alcohol syndrome. You find out that some people have crack babies as a result of the use of crack during pregnancy. Then a lot of people have trauma because some of them are driving under influence of the substance, or because of the influence of the substance, they fall into gutter. They have a lot of physical trauma. Then increased risk of infectious disease. Most of the people use who are actually injecting all the IDUs. You find out that they have a lot of infections like HIV, hepatitis, and the others. Then let's move to the psychological effects. You find out that psychosis is very common, especially in psychosis promoting substance that like cannabis. People use amphetamine, use cocaine. You find out that they are prone to psychosis, and psychosis means out of touch with reality, or colloquially we call it madness. They start having hallucination, delusions. So you have depression. You find out that a lot of people become depressed. They have pervading feeling of sadness. When we talk about clinical depression, we're not just talking about being sad or having blues. When you have a chronic period of sadness that you can't jack out of in 2 weeks, that's depression. Then some people have anxiety symptoms. Anxieties are irrational fears, irrational worries. And you find out that even after COVID, anxiety symptoms have been very important, has been very predominant. So some of them use this substance to actually medicate anxiety, and sometimes the substance also causes anxiety. Then some people have Othello syndrome. They have faithful partners that they are being suspected. They keep suspecting their partner. Oh, this person is dating this or sleeping with that or whatever. And all this are not true. They're actually delusions as a result of the substance. So let's talk about some of it. And sometimes suicidal ideation is very common. And that's why you find out that in this age, the rate of suicide has actually tripled. People just kill themselves and they die by suicide, and you begin to wonder, becoming a menace too. Then social effect, you find that marital disharmony, divorce, child neglect, people not taking care of their family, people not responsible, not living a responsible life. Then financial problems, they become indebted, loss of job, unemployment. Because you find out that these substances affect people's functioning and relationship. And if you can't relate well, you can't function well. So it's important that people know how to function, how to function. And it's because they can function, they can relate. Relationship is a function of your emotions. How you can relate with people, connect with people. But with substance, they are disconnected from people, except from substance users. Then more importantly, they have legal problems, arrest, incarceration. They have a lot of issues. Then academic setback. You see most of our patients, or some of our substance users, they change schools from one school to the other. I was attending to somebody who had attended about 7 schools in 3 different continents. And you find out that even the last school that he attended, he wasn't able to finish. Then social violence. You find out at the root of every violence, we're talking about Benue killing now. Why will some people just wake up and decide to exterminate a whole community? Because at the root of all these things, you have use of psychoactive substance, increased crime rate, violence, all this election violence, and even violence, kidnapping, insecurity. They are highly linked to substance use. Then breakdown of law or that stigma. A lot of people keep using substance because of the stigma, and people call them donkey. They don't want to relate with them, and because of that, they just throw in the towel. So we have so much to do. We need to understand the problem so that we can understand the solution. Thank you very much.
The problems are germane, and how then do we begin to manage? There was an article that I saw on WhatsApp that I want to just read a bit of it for us. I don't know who this person is or was, but I just saw the article she sent. She said, I shut my office door and wept. I couldn't hold back the tears, especially after stepping into the female hostel, now overcrowded. Every single girl under our care this session is under 25 years old. Some are even just 12. And here is what breaks my heart even more. None of these girls were rescued from the street. Every one of them was brought in by their own parents. While checking in bags at the both boys and girls hostel, we found paraphernalia, evidences of addiction, rebellion, deep-rooted pain. This is not just a problem. This is a pandemic. Let's stop pretending. Let's stop closing our eyes. Yaba Voice is opening up this conversation, and we're looking at understanding the menace. And Dr. Jai had really explored that with us. Dr. Courageous is going to take us further to help us understand what the challenges and opportunities are in addressing addiction, both at the local, the national, and the global level. Over to you, Dr. Courageous.
Thank you very much, Dr. Akintoyeshi. Well, in addressing the challenges and opportunities locally and globally, let me start with locally, the microenvironment. And what are the components of this microenvironment? The family, the school, religious organizations, and the school. It's really important that we look at these places, the microenvironment, to help with the challenges and opportunities. What happens in the environment? The first thing I'd like to talk about the stigma. There's so much stigma attached to substance use. People see it from the moral point of view, and it is not about morals. It's about it's a disease. So the stigma attached to it, people don't even want to believe that our world have this problem. Then our religious beliefs, we tend to spiritualize everything that happens. Then accessibility and affordability and availability. You go everywhere, it's everywhere. Yaba this hospital is known for peace, for tranquility, for sanity. But across the street on Yaba right, there's so much chaos there. So it's available, it's accessible. Then that's about it. We say it's available, it's accessible. The prevalence is high in the community. Where are the places where to seek help? The few places that are available to seek help are in the urban areas. What happens to people in the local area? Now, even where they are available in the urban area, Yaba has highly skilled staff. But can Yaba attend to 20 million people in Lagos State? No. What is the capacity of the personnel in those other places? Now, let's even come back home, out of pocket payments. These are challenges that people face. Let's go to the family. We're still talking about the micro environment that we need to work on to help in prevention. The family. What do families stand for? Family virtues have been eroded away. Families now, I tell people that those parents actually introduce their children to such things. You have bars in your house, and when that important visitor comes, you go and bring that important coat, wine, drink for your staff, for your friend or the visitor. So when the visitor leaves, the child feels important too, and he wants to take out of that drink. So even from home, they are being introduced to those substances. Family members send children, underage children, to go and buy all sorts. These are the challenges we are facing. So even if you have done the best of work in Yaba psychiatry, they go back to those families. Then religious organizations, they don't, they're not even aware of substance use, or they feel that they can cast out those demons, or they can do something for them and it is gone. It doesn't work that way. And what happens in the schools too, where prevention education is meant to start from grade 4. That means maybe like primary 4. There are evidence-based prevention curriculum that should be incorporated into the civic education in schools. That's about the microenvironment. Now let's talk about the macro environment, the challenges and the opportunities there. Policies. Nigeria is not bereft of policy. We are not bereft of policies, but implementation. Policies for prevention. Lately, I think the sachet alcohol was going to be phased out. And somebody came up and said, these are means of some people's employment. So policies are really important. What policies? Are there bars close to schools? These are and even policies for schools. The schools have form of rehabilitation centers, form of treatment centers for students. These are things that we really have to look into to help with our patients and to help most especially in prevention. Like we all know, prevention is better than cure. So the macro and the micro environment should be manipulated in such a way that prevention is really adhered to. And of course, then treatments too. It should be made everywhere. Thank you very much. I think I would like to stop at this junction.
Thank you so very much, Dr. Okorejo. Quite a lot to do, and seemingly quite a lot that are not in place. We'll start talking about parenting, we'll start talking about family, we'll talk about the ways in the older days where everyone, you belong to everybody. You're everybody's child, but now we lock them up in the gatehouse. Nobody corrects anymore, and those vices are just there. Not even with the rave of the Gen Zs. No, it's like it's coming with its own peculiarities. It's coming with its own challenges, and similarly, it's becoming quite difficult to just manage. Dr. Ajayi will be talking to us on how can we prevent addiction and what strategies are the most effective. Because if we look at what's going on there, it's just like we just say, God save us. But let's look at, in terms of prevention, what's are the opportunities or what are these strengths that are there? Yes, sir.
Okay, thank you very much, Dr. Koijo and Dr. Akintoye for that. And I want to, once again, I want to appreciate our listeners because this is actually a very important and sensitive topic that we need to talk about. It's a conversation that we need to keep going, and not just keep the conversation going, but we need to do it. Requires a lot of action, and that's why we're talking about prevention. The prevention is not only cheaper but easier than treatment. A lot of time we wait until the die is cast and there's little we can do. But now we need to start looking at it from inception, and that's why we need to start early. A lot of time we wait until the children start using it, or when they have already learned it in the wrong way. And that's why the issue of prevention is actually a multifaceted approach, and you need to look at it from different dimensions. The first one is education and awareness, informing about risk. A lot of people, children, they learn from their friends that are users. They tell them the wrong things, or what they want them to hear. They lie a lot about the substance. That, the substance helps you to do this, it gives you boldness, it makes you do this, and you find out that the initial symptoms, the short-term symptoms, it seems to agree with whatever they say. But on the long run, what happens? It actually destroys a lot of things. So we need to let them understand. They need to hear from professionals the short-term and the long-term effects of these psychoactive substances. Then promoting healthy choices, encouraging healthy lifestyle. such as regular exercise and balanced diet. They can reduce the risk of addiction. My people have a saying that when you want to take the bean cake from a child, give him honey. The child will give up the bean cake. If you, that means you must give them something more valuable. If they have something that has more value to them, they obviously will take it and give up addiction. Then early intervention for those people who are probably using, we need to identify risk factors early. A lot of us are not really bothered. How do we identify those risks? Just like the host was telling us that a lot of people wait until it is late. And I say, I never expect that my son or daughter will use it. We need to have our radars up there. We need to understand that every child is similarly susceptible. And because they are susceptible, we do our own due diligence at parenting. Parenting is one of the very difficult tasks. And you are not going to just fold your hand whimsically and just get it done. It has to be, you have to be very deliberate and you have to be on top of it as much as providing. We need to provide a lot of support in this for people who are similarly using or people people that can get initiated. Then community-based initiative. You find out that a lot of communities actually trigger the substance. And because of that, when the community they get involved, it's easier to deal with this issue. The typical Yoruba slang, they'll say, when the king is selling cannabis and the wife is selling alcohol, and you say you don't want trouble in the town, obviously you have a lot of trouble because you've already invited trouble. And because of that, we need to take the message to everybody in the community, both the king, the ones in the palace, every other person. If people at the Senate can stand for something, then obviously it will cascade down. And that's how community engagement is actually very important. Everybody's business is nobody's business. You need to get people involved. Let them be committed to it. Then support groups. We have a lot of support groups that can actually help people out. Good thing. A lot of NGOs are coming up now that are talking about substance use disorder. We need to do more so that we can cascade this information down to primary schools, secondary schools, and let people get information. Then family-based intervention is also very important because you find out that a lot of people, the family is actually the trigger. And because of that, we need to deal with the family as much as possible. So parenting programs, parenting is a very difficult task, just like I told you, they need to get it right. Then family supports. A lot of times, family needs support. Some of the families are bleeding. I've seen a family where the father was actually using cigarette and alcohol, and the mother also used alcohol, and the boy started using cannabis. And when I saw him, he said, "Oh, they brought him because of family problem." After all, the father was using cigarette and alcohol, and the mother was also using alcohol. So why is his own case different? Just because he's using cannabis? So it sees it as a family problem rather than the substance problem. So we need to let him understand all those things. School-based prevention. We've talked about substance use education. Need to educate them, and as much as possible, life skills training is also very, very important. Then we need to talk about policy and legislation. Well, some years ago, about 2 years ago, people were going to legitimize the sale of cannabis, and a lot of people came, pressure groups, the legislation, and policy was made that no. If those countries that have actually they legalized it, they've got more problems. They got more problems on their sleeves. And those are countries who have functional NHS or health insurance. We don't have health insurance. People pay out of the pocket. So do we want to add this to it? And the government was actually acceded to a cry, and they stemmed that bill down. Yes, it's going to give us a lot of money, But what about the reciprocal effects? It's going to also give us a lot of problems that we are not envisaging. Then forcing laws. We have a lot of laws in Nigeria that are not being enforced. We have so many laws. The enforcement is very important. NDLEA, they are doing a lot, but beyond criminalizing it, we need to also understand the disease model of psychoactive substance and do so much. The health-based prevention, screening and assessment. We need to be able to deploy our officials into the street. Let them screen, and people that are at risk. Let's start talking about treatment. And because of that, we can't do all this thing without having free treatment centers and free screening avenues. It's very important. Then technology-based prevention. Most of our diseases now, the only way we can catch them is online. So anything that is not online, they are not involved in it. So going to the street is a waste of energy. So where do we take the conversation to? Let's take it to the online presence, digital online resources, then digital interventions. How do we assess them online? How do we intervene? How do we help them? It's very important. It's something we need to start considering. Then environmental prevention. We need to start talking about creating healthy environments. Our environment is not safe. We're talking about then the massacre, then the kidnapping and whatever. It's messing up with a lot of people's mental health. And people that are vulnerable, that don't have the right coping strategy, they'll start taking to substances. And that's why there's a problem. We need to make these environments as safe as possible. Then reduce stress as much as possible. And just like we said, the illness and the condition is actually stress-induced. A lot of people get involved into use of substance because of the stress. And because of that, we need to reduce the issue of stress as much as possible. There is a lot of financial stress in this country now. What are we going to do about it? What's the government doing about it? What are the policies? Then individuals need to also learn better coping strategies as much as possible. Then cultural sensitivity. We need to be sensitive to every culture. You find out that there are some communities that are more prone, like the LGBT community. They are more prone to depression and a lot of other issues. We need to start looking at that. What about cultures? People that say sapele water, call now water. Is it really water? Is it affecting them? We need to start looking at that and how to help them out as much as possible. We talk about healthy life choices like regular exercise, balanced diet, mindfulness, then supportive relationship. Family support goes a long way, group support, then additional engaging in extracurricular activities, then setting personal goals, resisting peer pressure as much as possible. Then there are a lot of people don't have the necessary assertiveness training. We need to start doing that in schools as much as possible. Practicing, seeking professional help. When you think this thing is becoming overwhelming, when I cannot deal with it, what do you do? Seek professional help. Thank you very much.
Thank you so very much. When it's becoming overwhelming and you do not know how to deal with it again, then it's time for you to seek professional help. There is a question that was sent privately to me, and the question is for Dr. Boyejo. Now, this individual is saying they have a child who has been taken to different treatment center, but the child has refused to stop, and the child is still using. What can they do? This person is crying out and is saying they need help. They've taken him to different treatment center, but the child is still on the street using. What can they do? What's the word for this person here today? Over to you, Dr. Corrido.
Yeah, thank you very much. So I'd like to talk to the parents about, of course, like I defined earlier, addiction is a chronic, a long-term recurring illness. That is one. Another thing we should talk to ourselves about is what is our expectation? Are we expecting total abstinence or not? Is this child improving? Before now, he wasn't able to go to school. Can he go to school now? And so it is about multidisciplinary approach. If there is no improvement in all of this, let's look inward. The places we are taking this child to, what is the capacity of the personnel? Because it's not just about I've taken him to 10 different places. Where are those places that you have taken this child to? This child comes back home. Do you follow through the care plan that was drawn in those places? How is the family because it's the formal and the informal caregivers they have to be looked into. The follow-up for this follow-up visits and the rest of care for this patient. How are those things? How is compliance to the follow-up management of this patient? These are things that we have to look into. And like I said, success is not just about abstinence. Even improvement is success. If a patient that was earlier using so many substances and has reduced it is success. And we have to keep encouraging this patient. I will tell you, like we always tell people, and as it has shown, motivation waxes and wanes. So this patient needs all the support. And so it's important such parents or family work closely with the experts to be able to achieve success in this child. And success not as defined by the parent, success as co-jointly defined by the informal caregivers and even the patient. That's just the word of encouragement I would like to give for now. Thank you very much.
Thank you so very much, Dr. Okoye. There is somebody who's asking and is saying she had an armed robbery attack, and because of that, sleep has been very difficult. But after a while now, she started using cannabis, and it helps her to actually sleep, and she sleeps very well. But that's the only time she uses it. She's saying, one, am I addicted? That's the first question. Then how do I get out of that? Because she has now found out that she doesn't take it, she doesn't sleep. So how does she cope? Especially with the fact that there are still a lot of insecurities around, and hearing all of this news every time, aggravates and triggers her. So how would she cope?
Well, thank you for that question. I want to appreciate the person who sent that question because it's very important. A lot of people have had those kind of experiences, either armed robbery, kidnapping. Some people have been kidnapped within Lagos about 2-3 times. And those are burning issues. Whether we like it or not, they are realities of our days. So how do we deal with it? One of my friends told me her house was burgled, and she saw the armed robbers with a gun. And since that day, she stopped sleeping. For good thing, she's a doctor, so she knows how to seek help. But people that are not doctors, what do they do? People that are not professionals, what do they do? It's important to understand that cannabis, just like I said earlier on, they are also coping strategies, but they are maladaptive coping strategy. I tell my client that, yes, they are maladaptive. Why do you call them maladaptive? Because if you start with one problem, you are going to end with 10. So it's better not to start than to start and to now end with more problems. You are going to have more problems on your sleeves because cannabis is actually is a psychoactive substance and it can destroy your mental health. So the fact that you're having a gain now, every gain that you have had, you are going to lose it. So it's better to look for professionals. Rather than engaging in cannabis, we have what we call sleep hygiene. Look at that. Then we recommend breathing techniques too. If all those ones fail, see your professionals. You may be having more problem than a sleep problem. Probably you have developed early symptoms, insomnia as a result of depression or anxiety or some other deeper problem. So you need to see the professionals who will do proper assessment and understand what the problem is. But using cannabis to cope is a maladaptive coping strategy. You have started with one problem, you are going to end with more. So don't engage in that. Thank you very much.
Thank you so very much, Dr. Jared. Abraham AA wrote and said, prevention, educating children and parents by professionals, intervention for already addicted, life skill to overcome hydiness could lead to addiction, community sensitization on the implication of addiction, strict government policies to guide against, creating a habitable environment, avoiding negative stressors. I think it was just collaborating on some of the strategies that can be used. Thank you so very much for that. There is a question here from Yetude Alabi, and is asking Dr. Foyejo, will quickly take that for us. Please, is there subsidized or free management for addicted people whose parents cannot afford the service? Dr. Foyejo.
Yeah, thank you very much. Well, Henry Takashi Hospital Yaba is highly subsidized by government. Of course, you still have to pay some things. And so there's need. So when you come to the hospital, the services you're going to get is highly subsidized. And so for patients that might not be able to afford some places, I'll tell you that Yaba Psychiatry is the best. The personnel are there. And, it is not about just leave the stigma and walk inside and you get the best of care. This is where you meet all the professionals that are seated, and they are even going through training and retraining. So why go to places where you won't get the best of care, where you won't meet all the experts there? So it's highly subsidized, and this is what I will tell you. And for those that want to come, and you don't even need a referral, just walk in. No patient don't get turned back by the hospital. And the hospital works 24 hours, 7 days a week, 365 days a year. Thank you very much.
Thank you so very much. So what Dr. Korejo had said is, as much as Yaba, the Federal Neuropsychiatric Hospital doesn't offer a free service, it's highly subsidized. And this is one of the best that you would get anywhere. So apart from the fact that it's subsidized, we also have very trained trained professionals, addiction experts who can help us. Now, Ibrahim Hey also said, expectations should drive our approach. Compliance, motivation from parents and practitioners is key to success. Kudos to Dr. Korejo. Thank you so very much. Dr. Peter Adedibuyo says, thank you, Dr. Korejo and Dr. Ajayi, for your presentation. Is there any avenue where patient relative can learn about addiction? Dr. Ajayi, can you quickly just take that? Is there an avenue where patients relative can learn?
Well, in the drug board here, we have what we call parent-patient interaction. So the social workers have a day where they call all the parents and parents of substance users. Then more importantly, when people come in for therapy, a lot of time, or maybe for treatment, we use that opportunity to educate their family member. Because you see, a lot of time, the issue of substance use or addiction actually is in the context of the family. The family could be the ones that are enabling or the ones that trigger the condition. And without managing the family conjointly, you find out that the management of addiction will not be effective. Thank you.
Thank you so very much. That's well said. Canon Daramola said, thank you, our excellent speakers and Yaba Voice family for these all important awareness program. Addiction is such a family disease. One person takes a substance and it affects every member of the family. Yes, I agree with you. Illicit substance users and would-be users should take caution. Addiction changes everything. And that's well said, very well said. Faith Apology said it will be beneficial for the child to consult a professional counselor for psychoeducation, helping them understand reasons to stop substance use. This will enable the child to identify triggers and motivations for quitting. A crucial first step is for the child to acknowledge and accept their substance use. Yes, and that's part of what the addiction therapists help them to understand, because you have to take them through the motivational interview, help them to understand the need for change, the readiness, assess the readiness for change, and then help them to get into the treatment in itself. So thank you so very much for all of this. We will be taking the last comment from our speakers today. I want to appreciate everyone who has been on the call. Dr. Korejo, please, your last word to our audience today.
Yeah. To our viewers, I'd like to say thank you very much. And addiction is a family disease, and sometimes it starts from the home. And so it's important for the family dynamics to be intact to help the child be what it's made to be in the future. Thank you very much.
Thank you so very much, Dr. Korejo. Dr. Ajayi, over to you.
Thank you very much. Once again, to our listeners, I want to appreciate you for following us this far. Addiction changes everything about the individual. It changes the neuroarchitecture of the brain, changes the person's functioning and relationships. It changes everything and changes them negatively. All hands must be on deck to squash this epidemic. It's worse than COVID-19. worse than most of the things we have seen, because it's an epidemic that is staying with us. All hands must be on deck. Thank you.
Thank you so very much, Dr. Aja. Your own hands must be on deck to be able to deal with this issue because it's ravaging everywhere. There's so much fear in the hearts of a whole lot of people on what do we do next? How do we safeguard the lives of our children? A child who doesn't want to do, sometimes is lured into it. Sometimes unknowingly they get involved, and that is the end for them. And on this note, we are coming to the end of this month's webinar. This month has been very beautiful. Thank you for everyone who had been on this call with us. If you have or you need to be able to share this with somebody, just head straight after a few minutes from now onto the YouTube page of the Yaba Voice, FMPHY, Yaba Voice, FMPHY. You will be able to see this recording as well as previous episodes of the Yaba Voice webinar, and then you'll be able to access it. Please like and share. Send to as many people as possible. That's what we do. We want to be a voice where we can educate and inform people about the need to understand more about the mental health. And if you can do that, why don't you? Okay. Then we have something coming big coming in the month of July. Now, two significant things. One, July would make it 5 years the Yaba Voice have been running. And then we feel it's good to celebrate ourselves. You know, when you do good, you just celebrate yourself. And the medical director has given us the goal to celebrate ourselves. So we're going to be coming in a very good way. You know, just watch out on the YouTube page, watch out on the Yaba Voice, what's called the Facebook, on the Instagram page. We're going to be celebrating so much, and we're going to be talking so much about mental health. So it's coming big from us because 5 years, yes, we're trying to make a landmark celebration. And then again, next month, again, we'll also be looking at something very significant in the lives of the elderly in terms of their mental health. So two big things coming from us in the month of July. Watch out, and then we'll have something nice for you. Until then, please ensure the prevention is possible. It starts from the primary caregiver. It starts from the home. And when you notice anything, please get help. Don't run away from it. Don't hide away. Don't hide the child. Most times we do not want people to know, and because of that, we lock up the child inside. Please get help as soon as possible. It's preventable. We can also help them to manage it. And that's why the essence of what we are looking at today is also exploring solutions. There are solutions that can be explored. And we are open at the Federal Neuropsychiatric Hospital to also help you. No better position you to be equipped to deal with all of this. So please, you can reach out to us there. On behalf of the medical director, Dr. Olubenga Adekile Oweye, and every member of the Yaba Voice team, I want to say thank you for being on this call with us. Yes, the recording is there. It's on YouTube page. Yes, yesterday Alabi, the recording is on YouTube page. Yaba Voice FMPHY on the YouTube page. So thank you. Please go ahead there and check the recording of this episode. Share, like, and make comments. And please subscribe too. Bye-bye, bye-bye, bye-bye. Thank you so very much. Bye, everyone.